I'd love for you to introduce Diane Jarvis to us and have a conversation with her. Becky and I will jump in if we see any or hear anything that we want to know a little bit more about. And people also are able to come in on the chat if they'd like to make comments or questions. Just click on the link that's in the description here online. Okay?
For
So
sure.
Meina, take it away.
Thank you. Diane, if you just grant me 2 minutes before I introduce you. And today is a very special day. It is my brother Jack's birthday. My brother's 63 years old. And just before he turned 26, death came knocking on his door, pounding loudly. He was diagnosed with esophageal and trachea cancer, which had gone down to his left lung and the top lobe of his right lung. And if you can imagine the extensive nature of that disease, and he had surgery on his 26th birthday down in Boston because we didn't have the technology and the knowledge up in Canada to do it. So Boston's always, whenever I hear the word Boston, Massachusetts Hospital, I always have a moment of gratitude for that. And his life was spared. He didn't answer the door, and as a matter of fact, he told death to just take a hike. And it's amazing, and to have him in our lives 37 years later, and to celebrate his birthday. Unfortunately, he has got a bit of a lung infection, so he needs to take care of, because he's only got a portion of a lung, if you can imagine. He needs to take care of himself, and he is resting and getting strong again for another adventure in his life. So thank you for letting me share that, and that's why today was so significant to have the live launch, was in honor of him and his challenges. And yeah, and I know he's watching live, and I just want you to know, Jack, I love you very much. And I'm so glad that you're in my life. And now,
Meina, I want to just make a comment about that, because your book, When Death Comes Knocking at Your Door, sounds pretty, kind of foreboding in some black, and it has this beautiful door knocker. You can't see it here. But the thing is there are good outcomes too, in many different ways, even if a person passes, right, as I've read through your book. And I'm so happy for you and your family, and to know that there's both the joy and the sadness in your book, in those ways, in the stories that you tell. So welcome to your brother, and congratulations on his survival of death's knock.
All right. Such a cause for celebration.
For sure, for sure. And now, Diane, I want to introduce you. We've known each other since 1991. That's when I started working with you. You were already there, being a mentor, being a support, and later on being a friend. And now you are in the capacity of being my supervisor, which I just love. And I learned so much from you. You have an amazing, calm demeanor. You connect with not only the patients, but with the staff, where everybody just has the greatest admiration for you. You are an amazing wife, mother, and grandchildren, a grandmama of 3 little munchkins that are so darn cute. And I know you just went through an experience not too long ago, a few months ago, with your uncle, where you were executor of his estate. And I was wondering if you could just take us on that journey of what it was like when you became executor, and his journey of illness, and what he wanted, and the challenges that came with supporting him through that. So thank you for joining us today, and thank you for being part of this.
Welcome, Meina. And Jack, if you're listening, Meina speaks of you frequently at work, so I know how close you are. Yeah, well, Meina was the charge nurse over me for a portion of her career, and then she decided not to work full-time with us, and so someone had to slip in behind. So, any case, yeah, my story with my uncle's health, that last part of his health journey, really started a year ago, a little over a year ago. He has ALS, had ALS, I guess. and was living completely in his own home, totally independent, but we knew things were getting a little rough. He'd had a fall, broke his back, and never went back to his home again at all, ever, even until after we sold it, which was really tough. But that day that we went from Saskatchewan in Alberta, my mom's in Saskatchewan, I'm in Alberta, he's in Ontario, we went to move him from the hospital he'd been in for 6 weeks to a nursing home. And that was extremely hard. But at that point in time, my mom was supposed to have power of attorney of his finances. And she begged him, crying, please, please let the girls do it. I can't manage it. She was 83. So he accepted to sign that we would take over being power of attorney for his finances, which turned out to be an awful lot of work because banks don't cooperate a whole lot, especially across provinces. But the story for him and his health care was that he wasn't ready to go to a nursing home, and he had his wife suggested that it was going to be temporary until he got stronger, when we knew inside he was never going to get better because ALS doesn't improve.
Can you say what is ALS exactly in case anybody doesn't know?
Yeah, amyotrophic lateral sclerosis, but it's a nerve disease. It progresses more and more paralysis. So for him already at that point, he could basically not speak. He could not use any kind of computer because he was not tech savvy, never had been tech savvy. And he barely could use his hands to point and write. So for instance, to write one letter, it would take several seconds. So to get a word or a sentence written down was a very arduous process for him. And the only one who really read his mind was his wife, Eldora, who could communicate very, very well with him and understand every nuance of a head tilt to everything. So for the rest of us, it was very difficult. But I loved him dearly, and I was his godchild, which meant through all the years, even though he lived in another province, we were very close, and he did very special things for all of us, my siblings and myself. So come now to the end, more recently, I had power of attorney for finances. My mom and Eldora had power of attorney for health, but he never lost his mind. He always knew what he wanted. So at one point he developed a bowel obstruction. He had to go for surgery because he was in a lot of pain. And we all agreed that the surgery would help his pain. But we knew it wasn't going to help his ALS. And when he came out of that surgery, his IV wasn't working. So that means he wasn't getting fluids. And he had decided that he refused to have any more intravenousness, any more fluids through his blood vessels. And that meant we knew that he would pass away very, very quickly. So we wanted Mom to see her brother before he passed. So my brother and she went to Ontario right away to go and see him. And in the meantime, Eldora and Mom, who had power of attorney for health, but that's supposed to kick in when he doesn't have the cognitive ability to make his own decisions. So he was very aware, but he couldn't communicate well. So from Calgary, I had to draft a series of questions that they could ask him so that he could respond how he could with a nod of his head, which was not really truly a nod of a head. It was a shut up with his hand to make his head bob like a nod of his head. And that was his yes. So I had to craft the questions carefully and send them by email to Ontario so that they could ask him and be absolutely certain he did not want this intravenous and that he absolutely understood that that would shorten his life. So that was my role as a nurse, to try to figure out the wording in a way that he could communicate that everyone there would accept that he didn't want this intravenous. So Mom goes for her final visit with my brother. And the night before I'm supposed to go, because we think he's going to pass away quickly, and because I had the finance side, we thought we'd play tag team. My brother would take my mom down because she didn't want to travel alone, and I would return with her after the funeral. Well, the night before I was to leave and we were to do the tag team thing, my brother phoned and said, Uncle Fern says he wants an IV again. He wants a whole feeding tube, which he had said a year ago he never, ever wanted a feeding tube because he knew where his ALS was going. Once you have a feeding tube, you may last a long, long time with very little quality of life. But he decided and communicated that he wanted the feeding tube. This was the May long weekend, which meant that the IV had to go back in. My brother and I switched places, but I did not expect to be there long enough for him to pass away if he has a feeding tube. But Eldora and Mom and I felt very uncomfortable with him wanting a feeding tube because truly his communication was nothing. He couldn't move hardly in bed. The best he could do was his one hand bobbing his head up and down to say yes and no, like this. And he could look with his eyes where he wanted to look. If someone put something in his hand, he could shave himself, that one good hand. He'd shave for an hour. It was like his only thing he could do, his only independent thing he could do for himself. He'd have that razor in his hand for an hour. And he would pray the rosary. He could thumb through the beads. He would pray the rosary. So May long weekend, feeding tube doesn't happen quickly. And so we waited until Tuesday when all the whole through weekend, we were saying, Uncle Fern, are you sure you want this? I'm concerned that you're not going to have a good quality and you're going to take a long, long time and be here without being comfortable. You'll probably get bed sores. The nurses were wonderful at turning. I don't want to imply anything like that, but when a person can't move, any case, he still wanted it. But they wanted Mom and Eldora as power of attorneys for health to sign the consent, and they both were uncomfortable doing that. So again, we explained, and the doctor said it looks like he understands. He can make his own decision. So he managed to make an X and sign for himself that he wanted this gastrostomy tube. So he went and had a procedure, had the gastrostomy tube, which was very difficult for us and me as a nurse, because I tried as a nurse to care for him and not, I didn't want to be too forceful in saying, are you sure you want this? And on the other hand, I wanted medically to try to explain what it would mean health-wise for him. It wasn't really going to make him any better. The ALS would still progress. He would last longer in what I perceived was a very poor quality of life. And Eldora, of course, was wanting to spend as many waking hours as she could with him. And that was very taxing on her, exhausting for her to be there all the time in this, small kind of hospital room. His journey ended up that the feeding tube never did function. He was already too weak. His body could not take it. His organs were shutting down. So when he did pass away, only about 9 days after the feeding tube was placed, and 1 week after Mom and I left, having said our final goodbyes, knowing we wouldn't come back in time for a funeral in Ontario. So just a week and a half ago, we had a memorial in Saskatchewan for all the cousins and the people who loved him out west. And I guess that's my story.
Wow, Diane.
Diane, I just have a question. There was, we had a conversation about this earlier, and you were telling how your aunt had given your uncle permission. And can you expand about that a little bit?
Yes, and certainly we really wondered, once we realized the feeding tube wasn't working, he was hanging on, and actually she has a home care worker herself because she has her own health challenges, and that nurse suggested that maybe you just need to give him permission to go, that you'll be okay, when he goes. So, he was getting very weak, but still aware, still doing things like praying the rosary, still watching television, mostly sports, golf and whatever was on for sports. And so she told him, she says, I'm going to be okay if you go. I'll have Dad, and I have my sisters and all the other people around me. And so she offered him the rosary. They prayed the rosary together, and 10 minutes later he passed away. Oh, wow. And he'd been very aware. He was, nodding and telling her, communicating that he understood things, and so I think for her it was that he needed to know she would be okay before he could let go.
Yeah. Oh, that is so powerful. The permission that and how powerful we can be by giving permission. I know for myself with my father, I just remember him sitting with his head down in the nursing home and not speaking and not eating, refusing. And I just thought, how long is this going to go? And I just said out loud, I said, this is no way to live, is it, Dad? And he just looked up at me and he shook his head no. And I said, it's okay to go. We'll take care of Mom. And his head went down again. And 2 days later, he was gone. And I'm just so grateful that we just gave him permission to go. And same as your uncle, he knew that his wife would be taken care of. My dad knew his wife would be taken care of. And, we're just so powerful in our communication, even when people cannot communicate to us. Thank you, Diane. And thank you for this, not only the support you gave your family, but just the support you give to everybody that's in your life, your patients and your family and your friends. And thank you so much for being part of this and sharing your experience as well.
I'm very, very proud to know you, Meina, and be a friend and be involved with this. It's a very exciting venture. I feel like it reflects on all of us in our department to have a colleague who has accomplished so much.
Oh, yeah, you're at the Alberta Health Care Services. Is that tell us where you work?
Yeah, it's Alberta Health Services is the overall provincial organization, and we work at the Tom Baker Cancer Center in the radiation therapy department.
Okay, thank you. Diane, I just wanted to say what I heard from your story and what I know from the stories in Meina's book also is that these kinds of experiences are not necessarily straightforward, and that there are, not always clear paths for how to take care of someone, how to make decisions, both financial and both health. And even you as a nurse had dilemmas, and you knew from your own experience as a nurse what he was in for. And so you could try to suggest things to him, but ultimately the patient does have the final say.
Yes, right? Yes. Well, certainly with him, had been years since his diagnosis, since we knew he had already verbally even written down in his own hand that he did not want extenuating, life-saving measures. He didn't want feeding tubes. He definitely didn't want, anything like CPR. So when he changed his mind at the very last moment, we couldn't understand. We were trying to figure out if he all of a sudden just facing death so imminently, was he frightened for himself? Although his demeanor didn't seem that. He had a couple priests speak to him and just make sure that he was aware and make sure that he had, had his final sort of, the Catholics has the last rites with, forgiveness and all those sorts of things and the final kind of blessing. And he'd had all those things, and so we didn't understand. And looking back now, I do think it was mostly for him about leaving Eldora, as opposed to be frightened for anything for himself.
So did he have to have the permission to go?
Yes. Yeah.
And that's one of the messages that, Meina, you share in your book, and I know you've already shared here too, is that often it is those who are passing who are more worried about the living than themselves, and so giving permission to pass. And I know that as a nurse, you, like those nurses suggested to you, Diane, you, Meina, have suggested to other of your patients, and I assume, Diane, you may have done the same too, is just whisper to them that it's okay to go.
Yeah. Yes. Yeah. And, you know, even prior to what people face as the last, you know, the death sort of portion, their whole illness trajectory, cancer patients often try to protect their families, even at the initial diagnosis stage.
Yes.
And hide their symptoms and tell them I'm going to be fine, and not ask for help or say I'm having pain or I'm having whatever it is, difficulty swallowing, or, you know, whatever the issue is. So all along the trajectory, patients often are worried and protecting their families and not taking care of themselves as well as they could.
Yeah, which is why they need nurses like you all advocating for them, watching what they need, because I experienced that myself, as trying to protect my family from what I was experiencing and to try to protect them from the emotional pain. I thought I was strong enough, I can handle this, I'm fine. But I didn't want to deal with the emotional impact on them, because that's hard on a patient. And so that's what I think the message that you've shared today, Diane and Meina, Becky as well with your comment, and the message of your book too, is that nurses are advocates for their patients. They understand, especially experienced nurses, all the complexities of what's happening in a person's life who is facing these diagnoses, and all the ways to help them move through what Meina refers to as a transition, right? So is there anything else you'd like to say, Meina, to wrap this one up, to close things?
Just a huge thank you to everybody that's been supportive for this day to arrive. And Diane, thank you for your time. And Becky, your support has been amazing. And Laura, of course, you've been on this journey since day one. And it's pretty incredible.
Yeah, I'm very proud. And I just, I'm, especially whenever I work on a book like this, and the kinds of books that I want to work on are ones that it's not, I don't want this to get best-selling status just for best-selling status or et cetera. The main reason that that's so important is so that these kinds of quality books and messages get in the hands of people who can benefit from them. So I'm grateful for Becky's help and expertise actually in launching books. I'm grateful for nurses such as you and Diane, and for all of the patient advocacy that you do. And I look forward to hearing about the event tonight, and I look forward to this afternoon's interview as well. So thank you for everything. Thank you for being on. And thanks to all of those of you who have been listening.
Diane, it's been a pleasure to meet you and hear your story as well.
Yes.
Thank you.
And our condolences as well, Diane.